Hello and welcome to Lab Down Under. Today I'm talking with Dr. Nusrat Homaira about her latest research paper on COVID-19 vaccination conspiracy theories and rumours. In the research, Dr. Homaira and her team examined the spread of misinformation online, looking at the trends over time, on which social media platforms they were most prevalent, and basically we talked about what should be done with this information to kind of tackle the spread of these conspiracy theories and rumours in the future. So please join me, and I hope you find it as interesting as I did. Yes, so today I'm talking with Dr. Nusrat Homaira of UNSW about her research on COVID-19 vaccination conspiracy theories and rumours. And so, hello, welcome, Dr. Homaira. Thanks very much for sitting down with us today.
Thanks, Nicholas, for giving me this opportunity to talk about our research.
No worries. So, yeah, I saw your paper. I saw your put it up on Twitter first, and I thought, oh, this is something I've got to dive into, got to talk to you about. So, yes, the study itself, as I mentioned, looked at online vaccine rumors and conspiracy theories. You found over 600 different items, right? Were there any that kind of stood out to you as being the unusual, strange, anything that really kind of surprised you in that?
Yeah. So yeah, that's a very important question. Thanks, Nicholas. So we had around 637 items identified from it was a massive undertaking, and it was a collaboration between multiple researchers across multiple countries. So I guess when you talk about unusual items, whether we identified anything, I wouldn't say it was unexpected because, of course, we were following up the conspiracies or the rumors, hence we wanted to do this piece of work. But I think the main thing that stood out for us was repeatedly the misinformation or the conspiracy theory that was identified was that the vaccines are potentially going to have microchips that will be implanted into our body with the vaccines, hence to alter our DNA and thus control humanity and human race and all that, and that it will be operated by 5G networks. So, they will have access to our data and all those things. Sort of, we will be under surveillance. Oftentimes, these claims where these claims even mentioned that Bill Gates being involved in that, and so that was the major thing for us. The other thing that also came up, it was not as heavy as this one, but the other important thing that came up was that the vaccines using aborted fetal remnants in the vaccines, that was another big one. So yeah, I think these two were the major ones for us in terms of conspiracy theories.
Yeah, and those conspiracy theories, there are these fantastical claims, I guess, but with a tiny element of truth in there. Like some vaccines use like small fetal remnants from fetuses that were aborted like decades ago, something like that. The microchips, I don't know, that we've all got microchips in our phones tracking us. So there's a small element of truth, and it gets these kind of wild claims built up around those things, right? So I was just going to ask, did all of the like 600 odd conspiracy theories and rumors that you found, did they all fit into that kind of like pattern where, there was some element of truth in there, but then you had all these other extra layers built up on top of that?
Yes. So because the type of items that we identified, 91% of them were rumors and only 9% were conspiracy theories. So conspiracy theories are essentially wrong information or information that is spread with the intention to harm people. So that those 9% were conspiracy theories. The other 91% were rumors. So rumors can be true, false, or any sort of misleading or exaggerated information without any verified claim, like without being verified by an authentic source. So those are rumors, and so when we identified those rumors, we then went into fact-checking agencies to verify whether they were, false or true and all that. So, and then we classified our rumors in different groups, like, whether they were related to vaccine safety, vaccine accessibility, accessibility, vaccine production, and then, of course, the conspiracy theories. So those were different types of rumors and conspiracy theories that we identified.
Okay. Interesting. Yeah, that actually goes into one of the questions that I wanted to ask. How did you distinguish between the rumors and the conspiracy theories? So the conspiracies were kind of aimed, if I get that right, the conspiracies were aimed to mislead, whereas the rumors may have been more kind of harmless, kind of factual inaccuracies being shared around. Is that a good summary of it, or was there more?
Yes. So misinformations are generally that doesn't have any intention to harm somebody. These are just sort of things that are spread on social networks or medias and different other platforms, and they could be inaccurate, false, or partially true and all that. Whereas conspiracy theories are claims that individuals or groups make, and often to harm others. And they could be that there's absolutely true or absolutely false or an element of truth to it, but they are sort of magnified by groups or individual with the intention to harm others.
Okay, so I guess you've kind of touched on this. So about the importance of this kind of research, looking at these kind of things, the spread of misinformation online. So yeah, why do you think this is important, especially regarding COVID-19 and the pandemic that we're in?
Yeah, so see, this is an unexceptional time that we are. This is an exceptional sort of time that we are living in, and it still feels surreal every day, to be living through this pandemic. But we are also very fortunate. We have around 13-14 vaccines that are being used in different settings in the world, and many others in different stages of clinical trials. So, and vaccines, along with other proven public health measures, is going to be our way out of this pandemic, if we have to get out of this. So, and you can see even in Australia, we have been seeing that, how our sort of vaccine rollout program is being sort of affected by all the inflated sort of claims around adverse effect associated with AstraZeneca vaccine, which is a very, very rare side effect, but that is being covered so greatly in media that is impacting our vaccine rollout program. So I think these just proves how important it is for us to follow all these rumors and conspiracy theories. And in our research, we found out that majority of these rumors and these theories were spread on two major platforms, so Facebook and Twitter being those two. So, and we know these are the most visited sort of social platforms we have today. So I think it's important that public health agencies keep that in mind, that they should have monitoring or surveillance of these platforms as a routine activity, so that these misinformation claims and rumors are picked up. Because then when we develop public health communication messages to improve vaccine coverage, vaccine uptake, or any other preventive measures, if we want to engage the community, then we have to debunk all these myths. And to do that, you have to know what are the myths, and the only way we are going to know what are the myths is if we systematically monitor the outlets to capture all these different rumors and conspiracy theories.
And so that's basically what you did in this research, was look at the platforms like Facebook and Twitter and just collate everything, all the different rumors and theories that you saw. So kind of interesting though, because I remember Facebook made public statements that it was going to tackle disinformation around COVID-19, but despite those public statements, you still found Facebook was the most prevalent platform for this kind of disinformation, right?
Yeah, I think what happened with that was Facebook sort of came on board a little later on the pandemic. I think end of last year, probably early this year, that's when Facebook said that they're not going to let all this misinformation go on Facebook. And I think same happened with Twitter as well. Twitter is also actively screening. But, our research was still end of 2020, and we saw that there was 3 waves of misinformation. It's not like we did it till May 2021, because the paper takes time to write up and publish and all that. And we saw 3 phases of misinformation during that time. One was in the early stages of pandemic, which was Feb and May, and then June and September, and then October and November. So I think as these social platforms become more responsible in controlling what goes in and what goes out of those platforms, we are going to see an improved sort of circulation of more claimed or verified information.
Yeah, and going to the claims, sorry, the phases, I noticed in the graph, in the paper, there was a graph there with the prevalence. And so there was a massive spike around August. That might have been the June to September thing, phase that you mentioned, that wave of disinformation. Do you know why? Because that was compared to everything else, that was huge.
Yes.
Do you have an idea of what happened around that period?
I think if you look into the paper, there's another figure, which is figure 4, which shows two graphs, one with the misinformation and rumors circulating, and the other one was the internet searches for vaccine-related, like demand for vaccine information. So they were very correlated, and I think the surge that you see during that period was when we had those sort of the second waves of COVID-19 pandemic in different parts of the world, because US was a big one in our research, and Brazil, and so they were, as population gets severely hit by the pandemic, they also want a way out of the pandemic. Hence, you would see that there would be an association between number of cases with people wanting to find out if there is an sort of a solution or a vaccine or some treatment out of this problem. So I think that is why you see those two you see that peak and that correlation between number of cases, the population affected, and also people's need or hunger for an intervention to get out of this.
So in your view, what would you say is the one or two main takeaways from the research that you've done now?
I think, just the way we monitor case numbers, contact tracing, and all those other things that we do to monitor the progress of the pandemic. I think countries, both low and middle income and high income countries like Australia, we should have a system in place to systematically monitor all the different misinformations and rumors circulating in the media, and not just for this pandemic, but also for future health emergencies and health crises. Because clearly, Miklas, this is not the last pandemic, and this is not the first, and this is not going to be the last pandemic. And we are going to have many other health emergencies and health crises. So if there's a system, there's a surveillance system to sort of monitor those things, I think we will clearly benefit from that, not just for vaccine, but for any other public health intervention, because we clearly now know that it is so important to engage with the communities. And to engage with the communities, we have to address the concerns raised by the communities. They could be misinformation or right information, whatever that is. We have to address those needs, and to address those needs, we need to know what are their concerns.
Yeah, of course. You don't want to shut down questions. You just want to have the right, good answers to the questions when they're asked.
Exactly.
Yeah. So that's something that I guess that the government would have to do, or is there? Because that would have to be a nationwide thing, a nationwide surveillance operation of what's actually going out there. If people wanted to find out more about your research online, on social media or stuff like that, where should they go? I mean, I know you've got a Twitter account. Do you have anything?
Yes. So UNSW website has us listed, where you get our research profile, our publications. So that gives you an idea of what we do and what sort of our interest is. And then, of course, Twitter. Many of us who were involved in this research are very active on Twitter as well. So we not only share others' research, but also ours every time, something sort of comes out and publishes and all that. So I think those would be sort of my main. And then, of course, Google's Scholar, ResearchGate, all those other platforms where academics are visible. So I think LinkedIn, I think pretty much those would be the places I would say, like, who could easily find me.
Thank you very much, Nusrat. It's been a real pleasure talking to you, and I'm looking forward to seeing whatever else you're publishing in the future.
Thanks, Miklas. And Miklas, can I just request you, when this is posted on social, whatever platform you use, will you please send me a link so that I can share it with other researchers involved in the work?
Absolutely. I'll tag you on Twitter and stuff like that. So yeah.
Thanks, Nicholas. Thanks
worries.
for your time, and thanks for asking, all these questions, important questions about our research.
Oh, it's an interesting study, and I think it's an important study as well.
Yes.
So, yeah.
Yes.
Absolutely. All righty.
Okay. Have a nice weekend.
No worries. You too.
Okay.
All right.
Bye.
Bye. Well, I hope you enjoyed that interview. If you would like more information about Dr. Homaira's research, I will put a link down below to the Lab Down Under blog that I'll write on the topic, and also link to her various social media platforms and research pages where you can find out about the other studies that she's done as well. If you would like to support Lab Down Under, don't forget to follow us on Facebook, LinkedIn, Reddit, and of course YouTube. If you would like to subscribe, and don't forget to push the little bell icon as well. And we also have a Patreon page if you would like to financially support us, and so we can keep on making these kind of in-depth scientific blogs in the future. So until next time, keep on being curious, and I'll catch you around.